Thank you to the members of the Joint Committee on the Judiciary for the opportunity to provide testimony in support of H 1710 S 942, an act to promote public safety and better outcomes for young adults. I'm Dr. Destiny Tolliver, and as a pediatrician in Boston, I care for kids and adolescents from birth until their early 20s. I'm also a researcher who studies the impact of criminal legal system involvement on child and adolescent health. And as a pediatrician and researcher, I support this bill because shifting youth aged 18 to 20 into the juvenile system will improve public health and reduce health disparities. As a primary care pediatrician, I see children with behavioral difficulties starting at a young age, often following adverse childhood experiences, things like abuse, neglect, or even more common stressors like poverty and housing insecurity. For my patients, I worry, I research, and I advocate because I know what the research shows, that kids in lower income households, kids with mental health needs, kids with traumatic experiences are more likely to end up in the juvenile and adult criminal legal systems. And research shows that as many as 3/4 of incarcerated youth have a mental health diagnosis, and another study showed that 97% of incarcerated youth had experienced at least one of those adverse childhood experiences that I described above. In my own research, arrest in this young adult period was associated with depression, suicidal thoughts, and an over 2 times higher odds of premature death. And while I'll do my best to keep my patients out of these systems, I can't forget the ones who are already involved. We need to meet the health and well-being needs of these kids, adolescents, and emerging adults who have already been through so much. And what they need is support, resources, and another chance. And as you know, the juvenile system has a stronger emphasis on rehabilitation, education, and second chances. Providing supports to this age group is an important investment because the parts of the brain responsible for decision-making, planning ahead, and impulse control are still developing through the mid-20s. This bill has the potential to improve supports for youth during this critical developmental stage in a way that the adult system doesn't, which will improve their ability to make healthy and safe decisions in the long term. Additionally, each interaction with the legal system is associated with worse health outcomes, making recidivism a health risk factor. Recidivism also increases community levels of incarceration, which research shows is associated with worse community health outcomes, from worse birth outcomes to lower life expectancy. By moving young people into a more developmentally appropriate and rehabilitation-focused system, we have the potential to reduce recidivism and improve health outcomes for individuals and communities. And because young people and communities most impacted by the criminal legal system are marginalized by race, income, and educational achievement, this policy has the potential to improve health equity. This is why, as a pediatrician and as a researcher, I support this bill. It's an important step in improving the health of my patients. I appreciate your consideration of this bill and look forward to any questions. Thank you.